I'm Ashley Anderson here with Dr. Robert Harrell of the Harrell Dental Implant Center. Thanks for joining me.
Thank you. Glad to be here.
When a patient comes in for an all-on-4 procedure, what can they expect?
Typically, we start these patients with a consultation and a 3D cone beam scan. During that consultation, we'll evaluate the bone. We look at height and width and density of bone. What's really unique about the way we plan these procedures is our planning software. So when we plan for an all-on-4, we're able to go in really in real time while the patient's there with us, and we can plan the location for the implants. Patients love to see this. We put it up on a monitor. We do this together. They like to see what's happening. From the consultation procedure, we start taking records. And for most patients, this is just a series of photographs. We also take some optical scans, which are actually digital impressions of the mouth. In years gone by, we might use some of the goopy impression material that everybody knows. And those days are gone. We now use a digital process that allows us to take a scan with our CIRAC OmniCam system. So once the digital records are complete, we go into planning phase. And this is where it gets really fun. So for an all-on-4 procedure, we plan for what's called an in-sequence guide. And with this, it's a digitally fabricated guide that guides our surgery. So the day of surgery, patient comes in. For most of these patients, we will sedate them, either that or we'll put them to sleep with IV sedation. And once the procedure begins, we're able to take our digital surgical guide, and it really transfers all of the information from our planning session into the surgery. So what's really unique about this is that we start with a photograph of the patient. So we're looking first at what does the smile need to look like, and then we reverse engineer the whole process. So we set the teeth where they need to be to make a pretty smile, make the teeth functional, and then from there we reverse engineer the placement of the implants, the abutments, everything that's really required to build the all-on-4. So it's a revolutionary process, and the way that we do it with the in-sequence digital guides is truly unique. Not a lot of practices in the United States are even using this technology right now. There's plenty of practices that can do it the old way, but when you are able to see what the digital workflow creates, it's just a far superior process. So both for the surgeon and for the patient. And our outcomes, our treatment successes have been phenomenal. We've got some great photographs. It really makes a beautiful result.
And you all are well known for your use of high technology in dentistry.
We have always been a practice that's technology driven. Since I was a young kid, I've always been one of those that enjoyed the technology, enjoyed figuring out how we can use technology to better our patient experience, our treatment outcomes, and really just make the whole process better all around.
I imagine that sort of high-tech technology where it is measured down to the millimeter would make your patients very confident in the procedure.
It does. We like to do the treatment planning phase together. So we sit in front of a computer monitor and look at what the bone looks like, where we're going to place the implants, what the teeth will look like, and it really does give the patient that level of confidence and comfort to know exactly what's going to happen for them.
Dr. Harrell, thanks for your time today. We've learned a lot of helpful information today, and I hope you at home learned something as well.